Imagine this. You have a friend or family member who's constantly talking about their struggles, health issues, personal crises, even near-death experiences. At first, you feel sympathy, maybe even concern, but then you start noticing strange inconsistencies in their stories, details that don't quite add up. You begin to wonder, could they be making this up? Now, as odd as it may seem, there's a name for this behavior. Today, we're diving into one of the most puzzling psychological disorders, Munchausen Syndrome. It's a disorder that pushes some individuals to extraordinary lengths to fabricate suffering. Why would someone do this? What could drive someone to deceive even their closest loved ones? And what happens if it goes unchecked? So let's start with the basics. What is Munchausen Syndrome? Munchausen Syndrome is a factitious disorder. This means it's a disorder where people intentionally create or exaggerate symptoms, not just for attention, but sometimes for a much deeper, more complicated reason. And it's not always just physical illnesses they're faking. Munchausen syndrome can appear in a variety of forms. Physical illness. Claims. This is the most common. A person might claim to have an illness, or they might even go as far as inducing symptoms by self-harming to convince others they're genuinely sick. Psychological distress. Sometimes people fabricate mental health issues, like severe depression, anxiety attacks, or even claim suicidal thoughts to draw sympathy. Social and situational fabrications. And it doesn't stop at health. Some individuals create entire false narratives around traumatic events or hardships they've experienced to gain sympathy and support. These behaviors might sound extreme, but remember, this disorder goes beyond mere attention-seeking. In many cases, the motivations are deeply rooted in complex emotional needs, sometimes even a strange satisfaction from causing distress in those around them. You might be wondering, why Munchausen? Well, the term was coined in the 1950s by a psychiatrist named Richard Asher. He named it after Baron Munchausen, an 18th century German nobleman famous for his wildly exaggerated stories. Baron Munchausen was the kind of person who'd tell tales of riding cannonballs, fighting fantastical creatures, and performing impossible feats. The connection? Like Baron Munchausen's tales, individuals with Munchausen syndrome are known for elaborate storytelling and manipulation, often weaving complex lies to convince others of their suffering. All right, let's dig into the question of why. What drives someone to fake illness or distress? The exact reasons are complex, but here are some of the motivations that might be at play. Attention and validation. Many people with this syndrome feel they lack support or attention in their lives. By fabricating distress, they get that attention they crave. Sense of control. Imagine being able to control how others feel about you. For some, Munchausen syndrome gives them that power, manipulating emotions in relationships. Pleasure from others' distress. This is one of the more troubling aspects. Some individuals may derive a strange satisfaction from seeing loved ones worry, from causing them emotional turmoil. Escape from responsibility. And finally, pretending to be sick can sometimes be an easy out. By fabricating illness, they can avoid responsibilities, criticism, or other pressures they don't want to face. So, how can you tell if someone might have Munchausen syndrome? Here are some of the common signs. Frequent hospital visits. People with Munchausen syndrome often visit hospitals with vague or inconsistent symptoms that are hard to diagnose. Unusual medical knowledge. They tend to have an extensive knowledge of medical or psychological terms without any professional background. Controlling information. They might refuse to let doctors speak to their family members or access past medical records to avoid revealing inconsistencies. Self-inflicted injuries. In extreme cases, they may physically harm themselves to create genuine symptoms, which makes this disorder both mentally and physically dangerous. Now, Munchausen syndrome shares traits with some other psychological conditions, but it's unique. Let's take a look at a few related disorders to understand the differences. 1. Munchausen syndrome by proxy. Here, instead of harming themselves, a person will fabricate or induce symptoms in someone else, usually a child, to gain sympathy. It's similar, but adds a layer of harm directed at another person. 2. Narcissistic personality disorder. Narcissistic individuals crave admiration and might sometimes play the victim, but they don't usually go as far as creating medical symptoms. Munchausen syndrome is about a deliberate and often physically harmful deception. 3. Borderline personality disorder. Borderline individuals often struggle with emotional instability and a fear of abandonment, which can lead to attention-seeking. But unlike Munchausen, they don't fabricate illness as part of their condition. 4. Delusional disorder. People with delusional disorder genuinely believe in their distorted reality, unlike those with Munchausen, who consciously create symptoms. Number 5. Victim playing. This is a behavior where someone constantly portrays themselves as a victim. While similar, it doesn't involve the extensive medical deception seen in Munchausen syndrome. The effects of Munchausen syndrome can be devastating, not just for the individual but for everyone around them. Loss of trust. Over time, as inconsistencies surface, it becomes harder for loved ones to trust them. This erosion of trust can damage relationships permanently. Emotional exhaustion. Imagine constantly worrying about someone, only to realize they've been lying. Friends and family often feel drained, betrayed, or even resentful. Strain on healthcare resources. With repeated hospital visits and unnecessary tests, Munchausen syndrome can place an enormous burden on healthcare systems, taking resources away from patients who truly need help. Risk of physical harm. In extreme cases, individuals might take risks that cause genuine harm to themselves, adding physical consequences to the mental and emotional toll. If Munchausen syndrome isn't addressed, it can escalate in dangerous ways. Riskier behaviors. They might resort to increasingly harmful self-harm to maintain credibility, leading to severe physical injury. Emotional manipulation. The satisfaction from causing distress in others can grow, transforming into a form of emotional abuse where loved ones are manipulated and distressed regularly. Transition to Munchausen by proxy. In severe cases, individuals might start directing their behavior toward others, often children, putting those around them at real risk. So, can Munchausen syndrome be treated? Yes, but it's not easy. Here's what treatment usually involves. Psychotherapy. Cognitive behavioral therapy can help individuals identify and work through their need for attention and control, developing healthier coping mechanisms. Support networks. Family and friends can play a big role, offering support and guidance while setting healthy boundaries. Healthcare monitoring. For those with Munchausen, having a consistent healthcare team can help ensure that real medical issues are addressed while limiting unnecessary tests or procedures. Munchausen syndrome sheds light on the complex ways some people seek connection, validation, and control, often at the cost of their health and relationships. By understanding this disorder, we can learn to approach these individuals with empathy rather than judgment. Early intervention and awareness can help individuals find healthier ways to meet their emotional needs, protecting both themselves and those who care about them. Thank you for joining us on this journey into the mind. If you found this information helpful, don't forget to like, share, and subscribe to learn more about the world of psychology and mental health.